Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Greetings and welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. Thank you for joining us. Now, prioritizing your mental and emotional well-being is essential to your overall quality of life. Taking care of your mental health will help you better manage stress, build greater resilience, and maintain healthy relationships. So to help you keep your mental health in check, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By providing education on common mental health issues and offering strategies to prioritize your mental health, hopefully more people will feel comfortable talking about their own mental health challenges and seek professional help if necessary. Now, in this installment, we'll be discussing mental health in general in commemoration of Mental Health Awareness Month, which started today. Mental health touches many parts of our lives, from our relationships with others to what makes us feel fulfilled and how we deal with life's challenges. Mental health can affect factors like self-esteem and self-worth, the way we find meaning and value in life, and our psychological functioning. Neglecting our mental health can result in various mental illnesses that disrupt daily life, like stress, anxiety, and depression. In the U.S., 1 in 20 adults experience serious mental health issues per the National Alliance on Mental Illness, with symptoms often being invisible to family, friends, and acquaintances, or even invisible to oneself. That's why it is important to acknowledge when one's mental health is taking a toll. So to learn more about the importance of mental health, we're joined by Khadija Abdurrahman, the Director of Pharmacy at South Texas Health System Behavioral. Welcome, Khadija. Thank you for joining us.
Thank you for having me, Tom.
Now, first of all, this is the first time that we have somebody from the pharmacy department at STHS Behavioral with us, so we're really excited to have you here. And you bring a different perspective that I think that we've experienced before. So you have been working in pharmacy. You were on the retail side, and then you were in the acute care hospital at STHS McAllen, and now you're at the behavioral hospital. So tell us, from a pharmacist standpoint, how different is it working with behavioral patients versus the acute patients?
Yes, Tom. So again, thank you guys for having me. So with behavioral patients, initially out of pharmacy school, I was really interested in doing behavioral. However, with the pharmacy world, it's a little tricky to get into psych per se, just because we don't have a lot of psych resources in our country. Moving forward, so I went into retail pharmacy for a bit, and I really liked the individualized relationships I had with patients, and I realized that I wanted to do a little more with that. So essentially, going from retail, where I was talking to your grandma or grandpa every single day, to eventually going into more of an acute care, such as McAllen Medical Center, where I was more so behind the scenes. We were taking care of your IVs, verifying your orders, to now where I'm at behavioral, where I'm working one-on-one, not only with the patients, but with the doctors, with the therapists and nurses, to come up with treatment plans for patients and make sure that patients have the resources that they need to feel supported in their mental health journey.
And when it comes to the behavioral side, it's more individualized, right? Yes, there are medications that you prescribe to individuals that may be the same, but dosages may be different, or the times that you take it. So it really is more individualized than, let's say, somebody is diagnosed with diabetes and they're told to take this medicine 3 times a day.
Exactly right. That's what really intrigued me about behavioral to begin with, just because in psych, like you said, no two people have the same therapies, whether that be treating depression, whether that be treating schizophrenia, anxiety, or bipolar disorder. It's really individualized therapy from patient to patient. Some patients may need one antidepressant, while others may need several medications to help alleviate their symptoms. So that's the thing, is you have to work with your doctor and your healthcare team to come up with that therapy. But a lot of the times, patient might start one medication, for a week or two, and they have a lot of side effects or symptoms that they might not like, and they stop it all of a sudden. With these medications, it's also really important to remember that they take some time. So antidepressants usually take 4 to 6 weeks to even start working. However, if you do have signs or symptoms of reactions that are debilitating your life, you can go ahead and talk to your healthcare provider and they can make that change. But you also have to give these medications time to work, and that's something that unfortunately people forget on the daily.
Now, when it comes to acute care versus behavioral, acute care, I would assume the patient isn't as skeptical as maybe somebody in the behavioral setting, because they may be in a situation where they don't necessarily believe the medications are going to help, or they don't want to be on medications, versus when your doctor tells you you have high cholesterol, take this medicine and it'll elevate it.
Yep. So with psych, a lot of the ailments, you can't see them, right? There's no numbers, there's nothing to visualize. So a lot of the times people are like, well, my whole family is fine. How is it that I'm the only one in my family that's having psychological issues? Whereas in the acute settings, for example, if a patient has diabetes and they have a history in their family of diabetes or hyperglycemia or any of the other sorts of ailments, they have something to visualize with that, and they have something to compare it to. So in that case, they're more responsive to doctors' recommendations, whereas in psych, unfortunately, they become a lot more skeptical. And because it is stigmatized a lot in our community, a lot of people keep it on the down low and think that they can manage their symptoms by themselves until it's too late and they end up in a psych hospital.
Now, obviously, you're in the psych hospital setting, but let's talk a little bit about that stigma that I believe still exists in our community, but is it getting better, do you think? Are more people understanding and educated about mental illness and mental health, or do you think it's still a challenge to get people to understand?
So I definitely think we've come a long way within the last 10 years. I feel like with social media, with the presence people have, say on TikTok, on Twitter, more people are willing to talk about their mental health. They're able to connect with other people who may be experiencing the same things and have been more vocal about it. At least that's what I've seen on the day-to-day. But there's definitely still a lot of stigma in our communities, especially in the RGV, unfortunately. With our population of patients, a lot of patients believe that mental health is this facade. And so unfortunately, a lot of people go without treatment just because they think they can do it by themselves, or it's an illness that doesn't exist. But 50-50, Tom.
Yeah. Now, education obviously is key, especially when it comes to breaking the stigma, and you've put a presentation together for us to kind of walk it through some of the most common mental health issues. So let's get started.
Awesome. Alrighty. So the goal is to inform the public about mental health and highlight the importance of mental wellness. A little bit of history about Mental Health Awareness Month is that it was first observed back in 1949, May to be exact. Since then, it's grown to include various organizations and communities to advocate for working together to promote mental health awareness. During this month, many organizations share valuable information on mental health conditions, treatments, and resources through social media, through brochures, workshops, webinars, and community events. Communities hold events such as fairs and talks that encourage participation and foster discussion about mental health, normalizing the conversation around mental health. So some common mental health disorders include anxiety disorder, depression, bipolar disorder, and schizophrenia. Starting off with anxiety disorder, it's a condition that's characterized by excessive fear or anxiety. Common types include generalized anxiety disorder, panic attacks, and social anxiety disorder. Some symptoms may include persistent worrying, restlessness, fatigue, difficulty concentrating, and physical symptoms such as increased heart rate or sweating. But again, everybody's signs and symptoms may differ a bit. Moving on to depression, it's a mood disorder that's marked by persistent feeling of sadness or hopelessness, or a lack of interest in pleasurable pleasure in daily activities. Symptoms of this may include changes in appetite or weight, sleep disturbances, difficulty concentrating, fatigue, and in more extreme cases, thoughts of death or suicide. For bipolar disorder, it's characterized by more extreme mood swings that include emotional highs such as mania and lows such as depression. During the manic episodes, individuals may feel more energetic, more euphoric, or in some cases more irritable, whereas during depressive episodes, individuals may feel a sense of hopelessness or sadness. The frequency and the duration of the mood changes can vary greatly from patient to patient, which makes it crucial for proper diagnosis and treatment. Lastly, schizophrenia. It is thought to be one of the more severe mental disorders. It affects how a patient thinks, how they feel, and how they behave. It's often characterized by symptoms of hallucinations, which is seeing or hearing things that aren't there, and delusions, which are a false sense of beliefs. Schizophrenia symptoms may also include disorganized thinking and impaired functioning. So a little bit of stigma and misconceptions that we see in the community are, first of all, for anxiety, a lot of people see it as people overreacting or being weak. A lot of the public thinks anxiety is not a real illness, unfortunately, and that anxiety can be overcome by willpower. For depression, patients that experience depression, a lot of the times they're deemed as lazy or lack of motivation. They're considered, it's considered a temporary phase in their life that's only triggered by specific life events, where they ignore all other causes that might be leading to the depression itself. In bipolar disorder, a stigma is it's perceived as unpredictable or dangerous because of the mood swings. Patients are viewed as being moody or dramatic, and it's believed that all individuals experience the same symptoms and cycling. For schizophrenia, people are seen as crazy or out of touch with reality. Their behavior is associated with being dangerous behavior. Misconceptions include that individuals with schizophrenia can't lead a normal life or have relationships, when in fact we know that if they're taking their meds, they're following up with their doctors, they can lead a normal, long, and happy life. So ways we can support mental health in our communities is be open to communication, be an active listener for those around us, educate ourselves about mental health, encourage professional help when deemed necessary, model self-care behavior for ourselves and for the people around us, set boundaries for ourselves and the people around us, be patient, because unfortunately mental health does take time to be worked on. Check in regularly with your loved ones, with your support staff, and create a supportive environment for yourself.
That is great information, and you did talk about some of the most common ailments, but let's get down to the beginning. So the definition of mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. So mental health really is important. It affects every part of your life, from your relationships with your family members to your colleagues, as well as how you think about yourself. So it really is important to prioritize our mental health, right?
Yep, it really is. And unfortunately, like I said earlier, since it isn't an ailment that you can see, you can't visualize, people tend to forget about psychological well-being, whereas physical well-being is stressed on a day-to-day basis. We're always told we have to eat healthy. We're always told we have to exercise, get 8 hours of sleep, when we forget that taking care of yourself as well, it starts with your mind, right? Your mind is something that
your mind is something that you really need to protect.
Yes,
you need to
exactly.
you need to be concentrating on your mind. Your physical health is important, but your mind has to be strong to deal with the day-to-day challenges.
Yep.
Yeah, especially if you are experiencing health issues, you have to keep that strong mindset when it comes to your mental health. And obviously your mental health can affect factors like your self-esteem and self-worth. So you can look in the mirror and think negatively of yourself, or you can look in the mirror and say, I'm gonna do this, I look amazing, or I feel amazing. And it really can make a huge difference in the way you see yourself and others see you.
Exactly, exactly.
And then the way you socialize with others. So, I mean, we socialize, we're human beings, we're supposed to socialize with others. So if you, one of the key indicators is that you aren't socializing with anyone, right?
Exactly. You become a little bit more reclusive, you like your own space. We all like our own space from time to time, right? But you decide that you want to start self-isolating. A lot of the times we see people who initially love going out with their friends, love hanging out on the weekends with their friends, whatever the case may be, but slowly they start to isolate themselves, pull themselves back, start doing things by themselves. And a lot of the times parents will come in and be like, my son or daughter all of a sudden is starting to move away from everybody that they love. And unfortunately, this is because of their ailment. It's not because the patient's necessarily choosing to self-isolate, but sometimes there's too much going on in their lives that they don't know how to react, and the only way to react is to
isolate.
Exactly.
Your psychological functioning, as it's tied to memory and problem solving, so it can affect how you perform at work or at school.
Exactly. We have a lot of patients who come in. So with schizophrenia, it's usually diagnosed in early 20s. So the patient will be fine before that. They'll be a star student, they'll be a star athlete, whatever the case may be. And all of a sudden, one day, they start tending to stay at home a little more, or start to self-isolate in their room a little more. And then they become so disconnected with things that they used to love doing. And a lot of the times when parents are bringing in their children or their loved ones, they tend to ask us what's going on. Like, they were fine one day and then the next day all these behaviors started. And unfortunately, because it's not known that specific ailments exist, and some of the symptoms that may go on with these ailments aren't as talked about, they don't realize it may be schizophrenia or it may be bipolar disorder. So that's why we're here today talking about mental health, to bring some mental health awareness to the community, to make sure that if they do see a loved one or someone in their community suffering with these signs or symptoms, to make sure that they feel supported and they know their resources.
And when it comes to mental health and physical health, they are intertwined. They go hand in hand. Poor physical health can impact your mental health and vice versa.
Exactly.
Right?
Yep, that is correct. That's why I like to stress to patients, you get endorphins from exercising, and endorphins are the best, honestly, antidepressant around. So that's why it's really important to take care of yourself, but at the same time, it's really hard to take care of your physical being if your mental being is not where it should be.
Now let's talk a little bit about the warning signs of mental illness. So appetite changes. Tell us about that.
Okay, so some patients might either start to gain a lot of weight because they're eating, they're drowning their sorrows essentially in food. Whereas some patients we see lose tons of weight. So we've had patients where they'll tell us, within the last 2 months, I've lost 30 pounds. And such physical or such drastic changes in their physical appearance may be also adding on to their depression. So it varies from patient to patient, but we've seen weight gain and we've seen weight loss.
So if you notice a loved one who isn't necessarily exercising all the time and is losing weight, or has gained a little bit of weight that you're not used to seeing, it may be worth asking, are you okay?
Yes, definitely.
Now the next one is disruption of sleep, and I personally love sleep. If it were an Olympic sport, I'd win a gold medal. Like, I do love sleep, but I know sleep is really important. We should be getting about 7 to 9 hours of sleep a day. And when it comes to our mental health being impacted, we can either sleep too much or not sleep not enough, right?
Exactly, exactly. So that's the thing we see a lot with patients too. They haven't slept for days and they come in and it causes disorganized thinking. A lot of the times the rash decisions they make, the predicaments they get themselves into that bring them to the hospital, unfortunately, are because they haven't had enough sleep. With that being said, we do have antidepressants that help with sleep. So just in case anybody is having trouble going to sleep at night, or if they feel that's why their depression is worsening, they definitely can talk to their healthcare provider. A lot of these medications as well, antidepressants that help with sleep, actually for patients who are losing a lot of weight and don't have an appetite, we can actually prescribe antidepressants that not only help with their sleep, but also help stimulate their appetite so they can gain back some of that weight that they lost.
Another warning sign is engaging in risky behavior. And I think that is self-explanatory. You can just see that they are just conducting themselves in a dangerous manner.
Exactly. We can tie this a little bit more back to our bipolar patients, for example. So during those manic episodes, they are on this high. Unfortunately, during this high, a lot of them make rash decisions, whether it be gambling all their savings, whether it be buying a house in another country with savings that they don't have, whatever the case may be. But unfortunately, because it doesn't seem as if it's a symptom to maybe certain mental health disorders that we see more frequently, such as depression or anxiety, people don't realize this is actually being caused by their bipolar disorder.
And then we have mental distress. So that would be somebody who ends up in the hospital setting because it's more of an emergent situation.
Exactly.
Police may have to be called to come and assist, right?
And we do see a lot of patients that come in after using certain drugs such as spice. I feel like spice is one of the more since it is a synthetic drug, we aren't always sure what it's going to do to the patients. So we see some of our unfortunately worst presenting patients are the ones that abuse these synthetic drugs. And during that time, their first line is us, just because a lot of the times their loved ones don't know how to support them, law enforcement doesn't know what to do. So a lot of the times they'll come to our facility, whether that be they need detox, whether they need just support, whether they need somebody to talk to. We have an amazing team. Like I said earlier, it's not just the doctors, we have the nurses and therapists. We all come together and ensure that the patient's being heard. And then we also educate them so that in the future they don't decide to
engage in those risky behaviors.
Exactly.
that may lead back to a similar situation.
Exactly.
Which leads us, when you were talking about relationships, it leads us to another warning sign, which is negative impacts on relationships. So you're going to see that this person is losing friends, maybe they're not spending time with their family. So it really does impact, you're going to notice that if somebody is suffering, there may be a negative impact on those relationships.
Exactly. Like I said previously, they start pulling back, they become a little bit more reclusive. Things that they used to enjoy doing, they might not enjoy doing anymore. And so it's really important to check on your friends when you do start noticing those signs and symptoms.
Substance abuse, and we hear about substance use disorder a lot. So turning to drugs and alcohol to sort of numb the pain.
Yeah. A lot of our patients come in because of that. Alcohol, so it's so widely accessible nowadays, right? A lot of patients, unfortunately, that's what they use, like you said, to drown their sorrows. And with that being said, they don't realize the ultimate detrimental risk it could have on their health. Not only with their mental health, but a lot of our patients develop liver cirrhosis. A lot of them get irreparable damage from abusing these substances. So it's really important that you find healthy coping mechanisms besides alcohol, besides drugs. That's why it's really important to make sure that our community is aware of the resources they have and don't decide just to turn to alcohol or drugs to numb away.
And we've kind of touched on it a little bit, but the last warning sign is social isolation. So as you said, they sort of become reclusive and aren't really seen. You don't see them for a couple of weeks. They sort of disappear on you.
Yep, and we see that unfortunately a lot with our younger kids too. Like I said earlier, when they get to those 19, 20, 21 years of age, that's when we usually see our patients start developing schizophrenia. And it comes out of nowhere. And unfortunately, it's not their fault that they're engaging in this behavior, about whether it be reclusing themselves, whether it be pulling away from their family. It comes with the ailment, right? So we just have to ensure that we are supporting our loved ones when we do see this, and making sure that they are being seen and heard, and that they have resources available to them, so that they don't feel like they have to self-isolate to feel better.
And when it comes to mental health, unfortunately, it can impact anyone at any time. There isn't necessarily, everyone is prone to suffering a mental issue. And so some of the risk factors are adverse childhood experiences.
That is correct. Unfortunately, not everybody lives this perfect, happy life, and things happen in our lifetime, right? Some people take this trauma with them throughout their lifetime, and unfortunately, something that was repressed in their childhood catches up to them as an adult. So it's really important to seek therapy. It doesn't necessarily just have to be with medication, as long as you have somebody to talk to and discuss your history. And yeah.
And then past or present trauma. So we hear a lot about PTSD being a serious issue, especially, and when we talk about trauma, we found that there's the trauma that you may have witnessed. It's not necessarily a trauma you experience, but even witnessing trauma can have an impact on you.
Exactly. And a lot of the time, our war vets, when they come back from war, a lot of the times it's actually stuff they've witnessed. It's not instances that they were technically in, but unfortunately, seeing such severity and loss of life, it comes with them. And we've actually had people who fought wars 40, 50 years ago, whether it be Vietnam or Korean War, and they are still to this day affected by the PTSD. And they carry it with them, unfortunately. A lot of them, even with medication management, it's still there.
And then past or present experiences of abuse or assault. So that obviously has a major impact on you.
Yes. A lot of the times when people do come into the hospital, it's not necessarily an assault that might have happened right then and there, but again, it might have happened in their childhood or a couple of years ago, but something might have caused that spark where all of a sudden all this trauma
it rushes back.
Exactly.
You've suppressed it, and
long.
then all of a sudden something triggers it and it comes back.
Exactly. So it's just really important in that situation to find a healthy way to get yourself to the hospital, or talk to your healthcare provider and see what resources are available to you, just so you don't feel alone and isolated during this time of need.
And then the last one, which I think can affect any of us at any time, is sudden loss. So it doesn't necessarily mean a death of a loved one. It could be the loss of a job, the loss of finances that you used to have. There's so many different types of loss that can happen that don't necessarily relate to someone's passing.
Exactly. Another big one is loss of relationships. Some people, when they break up, unfortunately, they think that alcohol is the only thing that can soothe their sorrows, or drugs are the only thing that are going to numb the pain, when in fact they might have a really amazing support system that they're not utilizing. So it's just really important to know that nobody is above mental health issues. We're, like you said, nobody's this perfect being. Nobody's gonna be 100% in everything. We all have those repressed memories. We all have those repressed feelings that might erupt one day, and then all of a sudden you feel like you're cycling through all this
Now we hear the word resilience a lot. What is resilience and why is it so important and how can we build it?
Okay.
It's a lot of questions in one.
I know. So resilience is being tenacious, making sure that you're not only working on making yourself better, but you're bettering yourself for everyone around you. We do have to be a little selfish with our mental health, just because at the end of the day, if you're not taking care of yourself, who will, right? But at the same time, we do have to be mindful of the people around us. A lot of the time, we have such amazing support systems, and unfortunately, when we are going through these mental health issues, we want to recluse ourselves, and we might be pushing people away and doing hurtful things to push these people away. But we have to remember that these people love us. So we have to make sure that we're supporting our loved ones as much as they're supporting us. And being resilient means being a fighter. You can tackle
any challenge that comes your way.
Being a fighter, making sure that you're your number one cheerleader, I guess.
Yeah, there's a saying in Spanish that says, te ahogas en un vaso de agua, which means that you drown in a glass of water. So not having resilience is kind of that same sort of thing where you aren't able to handle the littlest challenge. Like there are some people who unfortunately don't have the resilience to be able to handle a slight, issue. And then there are those people who are strong enough to make sure, that they can handle even the heaviest of challenges. And so building that resilience allows you to hopefully deal with more and get through more. Yeah. I consider myself a little resilient, I hope so. Now, mental health is important at every stage of life. So let's talk about why it's so important in childhood. I mean, kids are developing and their brains are developing. And so it's important to make sure that we're prioritizing our kids' health as well as parents, right?
Exactly. Children are like little sponges. They absorb everything that they see. So if they live in this happy environment where they see mom and dad supporting each other, where they see grandpa and grandma on the weekends, they see this happy family unit, a lot of the times this goes on to their adulthood and they know what to mimic. Whereas if they're living in situations where they might not have the best possible care, or they may be being physically abused or mentally abused, unfortunately they think that's a normal day-to-day choice, and then they start implementing that, and then so the cycle kind of continues. So it's just really important that we present our children with a healthy image of a family life, and to ensure that they are getting the best possible attention from their teachers, from their parents, from their friends, whatever the case may be. And it's also really important that they feel like they can talk to anybody, especially their parents. I think that's a really big thing. A lot of people, or a lot of kids nowadays, they try to keep secrets from their parents, and unfortunately they think that because they're at this age, they can fix anything, when in reality we all need a little bit of help, right?
And you're talking about adolescence, which was the next stage I was going to talk about, because I remember being a teenager and thinking, I can handle it, I don't need to tell mom, I'll get through this or whatever, whether it's bullying or whatever it may be. But it really is important, especially as an adolescent, because you are dealing with hormones now, and your body is changing, and so there's a lot that's happening. And so if you're not taking care of your mental health at that point, you could also end up having some serious issues.
Yep. And then you end up spiraling. Yeah, so that's why it's really important to feel this sense of support from your loved ones, and also from people in your life that you see on a day-to-day basis, whether it be your friends, whether it be your counselors, whatever the case may be. It's really important to know that it shouldn't be stigmatized, and that mental health is just as important as physical health.
And obviously teenagers, it's really hard to read them because they'll go into their room, they'll shut the door, they don't want to talk to anybody, they get a little moody, and so it's hard to really distinguish. So what advice do you have for a parent to kind of hopefully get through that challenge? What would you want to tell them?
Well, children are fun to deal with, right? So honestly, what I've realized works the best is communicating, talking. Whether it be trying to hang out with them. A lot of the times when I'm at the hospital, if I see somebody who tries to stay to themselves or isn't engaging in group activities, I try to go talk to them. I know it sounds super simple, and if that's how easy it is to deal with kids, then everybody would be doing it. But honestly, just getting down to their level and talking to them, and not as a superior, but as somebody on their level. The thing is with kids, I feel like they respond better when you respect them. And with that being said, essentially coming at them eye level, right? Not talking up to them or down to them, whatever the case may be. Just meet them at eye level. And at the same time, at the end of the day, they are smart little ones, and they know when somebody is trying to manipulate or trying to get their way. So honestly, coming to them with this sense of respect and just hearing them out, a lot of the times I see that working the best way.
I know whenever I talk to a kid, I always try to get down to their level. So I'll kneel down and talk to them that way, because it really is important to be eye level and to know that they're not looking up to you in that way as a superior, so to speak. And then obviously we talk about adulthood and how important it is to prioritize your mental health. We can drill that all day, but I think another population that we kind of forget is our seniors, because as we age, we also have sudden loss that happens when your grandparent loses their, your grandfather or grandmother passes and they're left alone. There's also, so you see a lot of depression so it's making sure that we don't forget our older adults, right?
Exactly. Make sure to visit grandma once or twice a month. Take them out to lunch. It's little things that you might think are not as important, but they mean the world to these people.
Now, you talked about anxiety, depression, bipolar disorder, schizophrenia. Which one is the most common that you see in the hospital setting?
So it varies. There's sometimes where I feel like I see more schizophrenic patients. Sometimes it's more bipolar patients. But honestly, we have a pretty healthy mix of everything.
And which one is the most challenging to treat, do you think, in the hospital setting?
So the two that I think are the hardest to treat are schizophrenia and bipolar disorder. Bipolar disorder, because a lot of the times it's misdiagnosed. So a lot of the times the patient will come in during the depressive state, and so the healthcare provider sees them depressed. Okay, they have depression. They start them on an antidepressant. But unfortunately, starting a patient with bipolar disorder on an antidepressant actually makes them cycle. So they start becoming super manic, and then they start becoming super depressed, and unfortunately it's a vicious cycle. So that's the one that's a little bit harder to diagnose outpatient, but then treating schizophrenia is on a ball game of its own. Unfortunately, we might have to try a couple of therapies on a specific patient, whereas one patient, it only took one medication to diminish the voices and the hallucinations.
And then with bipolar disorder, I assume that you're going to have difficulties, especially when someone's on a high and they think they're great and they don't need to take their medicine. Is that what you face every day?
Yep, yeah, because they're in that manic high and they're on top of the world. They feel like they can conquer anything. And unfortunately, a lot of the times when our patients get off their medications, it's during the manic episode because they think they don't need the medication anymore. And that's unfortunately a reality of a lot of healthcare providers. They see this on a day-to-day basis. But that's why we have to make sure that we are stressing the importance of being compliant with your medications, because although you might feel good, it may be the medication doing its job. And once you get off the medication, unfortunately, you fall back into this vicious cycle of rapid cycling.
And then let's talk about how you can improve your mental health. So obviously making lifestyle changes, it's really important. And those relate to obviously exercising regularly. And you talked about how those are the feel-good hormones that we need and that we need, those chemicals that'll help us. It's natural, and it helps us feel good. So exercising often is really important.
Yes. Those endorphins, like I said, you can't get a better antidepressant than endorphins. So really do stress with our patients that take care of your physical being, but at the same time, we do understand that sometimes it's hard to take care of your physical being if your mental being is not okay, right? Another thing that I personally try to implement on my day-to-day basis is eating healthy, because honestly, when you eat healthy, you do feel it. When you exercise, you feel it. When you have a good support system, good friends, people around you in your day-to-day life who you feel are there for you during these hardships, it's really easy to think that you're on top of the world and you can take anything as it comes to you. But at the end of the day, we're all human and need a little bit of help. And so by implementing this exercise, by implementing eating healthy, by keeping a really good circle around you, it really does help deter from.
Having a balanced diet is really important. Those are the two key things when it comes to maintaining good health, is exercising and eating well. And processed foods, unfortunately, are not good for you. And it seems to be when someone is experiencing depression or anxiety, they reach for a bag of potato chips, let's say, and it's not necessarily the healthiest option, which can only compact the situation, right?
And that's true. And unfortunately, in our day-to-day life, when you go to the grocery store, buying a bag of chips, unfortunately, is sometimes cheaper than buying, say, like a veggie fruit or fruit tray. So unfortunately, people tend to gravitate towards those options because of also this money problems, right?
Yes.
So unfortunately, that's seen on a day-to-day basis. People's socioeconomic
their background. If you unfortunately don't have the means, it may be a little bit challenging to pay a little bit more for the healthier option.
Exactly. Yeah.
Another thing is, and we've talked about it a little bit, is the importance of sleep. Getting adequate sleep. We can't stress that enough. Like, not sleeping, your body needs time to recover after a long day, and if you're not giving it that, it can start messing with the chemicals in your body.
Yep. A big thing that I stress to my patients is sleep hygiene. Unfortunately, we're glued to our devices nowadays, whether it be the TV, whether it be our cell phones, scrolling through TikTok right before you fall asleep. It's really important to engage in good sleep hygiene, meaning putting away that device maybe an hour or an hour and a half before you decide to go to sleep. Making sure that you are in a dark room, making sure that you are in a cool, dark room where there's no distractions. Just engaging in that sort of behavior actually aids your sleep tremendously. What I used to do in school, because sometimes it would be a little harder for me to sleep because of the nights where I'm staying up for exams, what I would do the next day is I would make sure that I had time to recover. And so unfortunately, if that meant at noon, if I needed to take a 4-hour nap, I made sure that my blinds were closed. I got into my little, I call it my cave, and I took my nap. But like you said, at the end of the day, we need to make sure that we are giving our body time to recover. And without having that time to recover, unfortunately, we tend to fall into these signs and symptoms of mental health disorders.
Another way that we can improve our mental health is through therapy. And I don't think we talk about the importance of therapy enough. I know locally here in the Rio Grande Valley, it may be the stigma surrounding mental health, but I've lived in California and New York, and people always talk about, I talk to my best friend and she'll be like, oh, my therapist, I talked to her yesterday, she said this, and everyone talks about therapy and going to therapy, but for some reason, there's that stigma where going to therapy is a bad thing.
Yeah, and that's funny that you actually mention it, because sometimes I'll be scrolling through TikTok and this is what my therapist said to me, or this is what my therapist said to so-and-so. Whereas I feel like at least on the daily, I don't genuinely hear people talking about therapy or talking about seeking that help. And at the end of the day, we all need a little bit of help. Like, none of us know everything. And to have somebody who's an expert and knows how to deal with these emotions, I think it's an amazing resource that we don't utilize enough.
And it doesn't, you don't have to be experiencing something right this minute to go and see a therapist. You don't have to start having signs of anxiety per se, but it's just having an outlet to go when life gets a little bit challenging, like having someone that's a listening ear, that's unbiased, because I know you can turn to your family, and I know the challenge of what do you want me to tell you?
Yeah.
You know what I mean? Versus a therapist is just going to listen and tell you unbiased what they think is going on. Another thing is support groups. Support groups are really important, and I think especially because your physical health and mental health are intertwined. There are support groups to help patients who are dealing with the effects of a stroke. There's a Parkinson's group that we have at STHS now as well. And so, but having those outlets of having individuals that you can talk to that are going through similar situations or whatever the case may be, but just having that listening ear of somebody who's been through it is important.
Exactly. And that's a big thing I hear from my patients on the units. A lot of the times they'll come in and they'll say, oh, so-and-so was telling me this, or when they're in their groups and they are sharing their experiences, a lot of them can relate to each other. And honestly, I feel like that harvests this environment of feeling supported. And unfortunately, it might take getting to the psych hospital for them to feel like they have that support. But ultimately, when they go out, they know they have their resources. And like you said, they have different types of groups. A popular one is also AA, where you can share your story and people around you may have a similar story, so you feel like you're being accepted. So I really do think that is something that people need to utilize more and more.
And the last one is one that you're an expert on, and that is medication. So not being afraid to take medication if it's prescribed to you. I know that there is that fear that you're going to have to take it for the rest of your life or whatever it may be, but medication really is beneficial to helping you stay level.
Exactly. And a big thing that I like to talk to my patients about is when you are diagnosed with diabetes, your doctor tells you you have to go on oral medication or insulin to make sure that your blood sugars stay within a normal level. You listen to them, right? Why is it with psych when we're telling you that you are experiencing these symptoms of depression and that this antidepressant may help with the balance of the chemicals in your brain? Why is it that you're more hesitant to comply with that therapy? And again, I think this stems back to mental health being something that's not visual. You can't see it. Unfortunately, you kind of have to just go by the signs and symptoms. And even when patients are being diagnosed, we have guidance using the DSM-5, but there's no specific guidelines to depression, how to treat it, which antidepressant to start off with. At the end of the day, it's a little bit of trial and error. Unfortunately, it is a gray area just because everybody's brains don't work the same. Everybody has different balance in their brain, right? So having to try a couple of antidepressants to see which one your body reacts to well sometimes has to be done to ensure that you are being taken care of correctly.
Let's talk a little bit about some of the types of medications that you may have to take. So antidepressants, what are those and what are they typically used for?
Okay, so for antidepressants, they are used for depression. They're also used for, like we talked about earlier, insomnia. So some antidepressants are actually used to treat insomnia. A big thing about antidepressants, unfortunately, a lot of people don't realize is they do take time to work. They do take about 4 to 6 weeks to work. So if you start them and you don't see results after a week or two, be a little patient. However, if you do get side effects from these medications that are intolerable, go ahead and talk to your doctor, because then you might need to be switched from medication.
And then let's talk about antipsychotics.
Yes. So antipsychotics, so these reduce psychosis symptoms. We actually have typical antipsychotics and atypical antipsychotics. Typical antipsychotics are more of our older antipsychotics, such as Thorazine, such as Haldol and Prolixin. So a lot of our patients don't really like these antipsychotics just because they work on the dopamine receptors and they might have unfavorable side effects such as extrapyramidal symptoms. So we do have the newer antipsychotics, which are our atypical psychotics. These include like Abilify, they include Invega and Seroquel, and these are a lot more tolerable with patients. At the end of the day, it's, like I said earlier, it's really individualized therapy, and certain antipsychotics might work for some people, whereas other antipsychotics may work for other patients. I've seen patients where we've unfortunately had to try several different antipsychotics to see which one is the most tolerable in them, or which ones may minimize or reduce the voices or the delusional beliefs that they have. And we also, a really cool thing about antipsychotics is we have long-acting antipsychotics. So instead of taking a tablet every day, a patient can get an injection once a month and they're covered. And so that helps a lot with compliance, and a lot of our patients tend to do a lot better with those, just because unfortunately sometimes it's hard to take meds or multivitamin every single day.
And then you have benzodiazepines. So tell us, what are those?
Yes. So benzodiazepines are what we actually use for anxiety. Sometimes we can use them for insomnia as well. These medications are also actually used for seizure disorders. So not only do we have patients with anxiety on them, but we sometimes have patients with seizure disorders. And with these medications, when they are abused, unfortunately, if a patient comes to the hospital, we have to ensure that they are tapered down, because if you cut it cold turkey, so to speak, they can have seizures from withdrawing from these medications.
And then the last one that we'll talk about is stimulants. And so ADHD is a big issue. So stimulants are prescribed to help with things like ADHD?
That is correct. So a lot of the time, a lot of our younger patients in the developmental years, a lot of the times their school nurse will call or their school teacher will call and let the parent know. So it's having a difficult time participating in class. They're either being disruptive or they can't concentrate. A lot of the times in those situations, the parent takes the child to a psychiatrist, and ultimately they'll need ADHD medication such as stimulants to help them focus.
All right, and then some important considerations when it comes to medication. So number one, medication is not a cure.
Exactly. Medication unfortunately can help with the signs and symptoms, but that doesn't mean you're necessarily going to get rid of the disease state. There are a lot of times, however, for example, with depression, you might be doing so well with your antidepressant that you come to this point where you don't think you need it anymore. In that specific case, you should talk to your doctor. You can actually taper off of it. And a lot of the times we do see patients who, after years of taking it, decide that they want to taper off of it because they think they can do just fine without the medication, and they are successful. So it's just really important to be patient with yourself at the same time, just because, like I said, everybody's brains work differently, and the chemical imbalances at the end of the day aren't the same for everybody. So although somebody can eventually get off their antidepressant, doesn't mean necessarily it's the best interest for you.
Medication is often most effective when combined with therapy and other support services, so not depending on the medicine alone.
Exactly. And that's why at South Texas Behavioral, we really do stress the therapy aspect as well. Just because sometimes patients might want to stay in their rooms and just take the medications, and they think that's essentially the therapy. You actually have to talk about it. You actually have to hear other people's stories, and I feel like being able to compare with other individuals who are going through the same life struggles as you are, a lot of the times that builds that sense of community, and they feel like they're not alone in this. And so that's why it's really important for therapy, whether it be group therapy or whether it be individualized therapy. At the same time, with individualized therapy, it's nice because you have a third party talking to you, and they're very unbiased. So it's nice to have that support and those viewpoints as well.
And then medication, it takes an individualized approach. It means that it's not one size fits all.
Exactly. Prozac might work for you, sertraline might work for me. So it's really important that you talk to your healthcare provider about that. And the thing is also with a lot of these medications, they might cause side effects. So if specific side effects are a little bit more intolerable, your doctor can try a different class of antidepressants. And thankfully, we have several different classes. So not only do they help with depression, some of them even help with weight loss. Some of them even help with sleeping disorders. So.
And the last one is long-term use. That some medications you may have to take for a longer period of time.
Exactly. That's what I had been mentioning earlier, for example, with antidepressants. Some patients may be able to get off of it for after a couple of years. Maybe they had certain tragedy in their life that happened and they needed the support of the medication as well as therapy. And then once they've overcome that obstacle, they feel like they're more in control and can taper off of it. Whereas some people, unfortunately, because of the trauma that they might have endured, or because of the chemical imbalance in their brain, they may need to stay on the medication for a longer period of time. But it's really important just to know that at the end of the day, medication is there to help.
Now let's talk a little bit about self-care. We hear that important word. It's a popular word that we hear. Why is self-care so important?
If you don't take care of yourself, who's going to take care of you, right, Tom? So that's why it's really important to have those little things that bring you joy, that make you detach a little bit from reality, whether it be going out with your friends, whether it be doing your nails, whether it be having a specific little hobby. It's really important to have something for yourself that makes it so that you're looking forward to something. At the end of the day, our lives are busy 24/7. We're always doing something. We need that time for ourselves where we can be a little bit more selfish and do something we enjoy. So that's why self-care is really, really important.
And again, it's not one size fits all. What you love to do on your spare time,
exactly.
You may want to go run a 5K. I may want to walk in the park or take a hike. It may be different, but finding whatever it is, finding whatever brings you that joy, right?
That is correct.
And if you don't have ideas on what you should be doing, it's too complicated for you to think about. I did find online on actionforhappiness.org, and they have monthly calendars that you can print out. They kind of look like this, and you're able to do, it's kind of like a bingo. You can do it on your own. But Sunday on the 1st, you find time for self-care. It's not selfish, it's essential. On Monday, the 2nd, you notice the things you do well, however small. So it's giving you some ideas of things that you can do. And I think that's great, especially sometimes we can't think, and sometimes it's just the littlest thing that you can do to remember. So mindfulness, gratitude, meditation, relaxation techniques, all of those things we hear about that we may not know how to address them. This little calendar can just tell you what to do. It forces you to do it. So I think we should try this. I'm gonna text you. Did you do today's lesson?
Let's do it.
All right. Now, last question. When should we seek professional help?
I recommend it when you feel like there's nothing else you can do. Honestly, you should never feel like something is too minute to seek professional help with. But I know some people think that going to the doctor and telling them you're anxious because of a test or because of this or that might seem counterproductive. However, at the end of the day, everybody deals with their emotions differently. So that little bit of stress, whether it be from an anxiety from a test or anxiety from a life event, is triggering something. I think it's important to seek medical help right away. Nothing is too little to seek medical professionals' help. At the same time, it's better early on so that you can treat it. Whereas if you end up at a hospital, unfortunately, it means it's more critical and some things may have led to you being there. So honestly, I recommend whenever you think you need help, you should seek help.
All right. Well, thank you so much, Khadijah. We really appreciate your time.
Thank
we
you.
hope that we can have you back again in the near future.
Yes, I would love that. Thank you.
All right. Thank you. And that officially concludes our webinar. We thank you for watching. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. If you are experiencing mental health challenges, STHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment programs. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 956-388-1300. Please remember that you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Line at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, June 5th at 5:30 p.m. live via Facebook, when we'll discuss distressed behaviors. We hope you can join us. And to watch our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.